When can you return to work after rotator cuff surgery? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist. I provide education, insight, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. When I'm in the office and a patient is looking to schedule surgery, granted, my assistant, my medical assistant, does the surgery scheduling, but I can hear sort of the back and forth going on between my medical assistant and the patient. And a lot of times, one of the discussions when they're trying to figure out when they should have surgery, it boils down to working around some kind of work obligation, or when can they get back to work. It might be school, it might be a trip, but work is by far the most common one. And so I think it's an important thing that you ought to think about, whenever you're planning any kind of surgery. Can you get back to doing what you need to be able to do at work? And so in today's Ask Dr. Geier video, we're going to talk about that very question when it comes to surgeries of the rotator cuff. Jamie asks, is it entirely out of the question to return to work 2 weeks after rotator cuff surgery? I mean, like I said, it's a terrific question. There's really two things you have to think about when you're trying to answer this question. The first is, what type of surgery is it? Rotator cuff tears, that's a shoulder injury. Those are tendons of the tip of your shoulder blade that help to stabilize the shoulder while the bigger muscles move your arm around, overhead, not away from your body. Those can be torn, or they can just be irritated in shoulder impingement. If there's a complete tear, we're talking about a rotator cuff repair, where the surgeon goes in and reattaches the tendons to the bone. A much more restrictive recovery, because you have to protect the arm, basically not move it too much in the first few weeks so that you don't damage the repair. So certain motions like overhead motions are restricted, lifting is restricted. A lot of times you'll have to wear a sling. That's a very different recovery than a surgery where you go in and just clean up, maybe some fraying of the rotator cuff tendon, and you clean out bursa, maybe you smooth out any bone spurs. That's called a subacromial decompression, maybe a debridement of the rotator cuff. The restrictions after surgery generally aren't there. You don't have to wear a sling, or if you do, it's for a very short period of time. You don't have to limit your motion, how much you lift, things like that. So the recovery would be quicker, but more importantly, for the purposes of this discussion, getting back to work would be easier. So that's the first thing you want to know, is what the nature of the surgery is. A good question to ask the surgeon. The other side of it really comes to, what type of work do you do? What are the physical demands? So if you work a desk job and you're just writing and typing, you probably could get back to that very quickly, because you can keep your arm by your side and type and write and things like that. So that is a very different type of thing than if you do physical labor where you have to use your arms, where you're lifting, where you're reaching overhead, things like that. That can be a longer process. And so if after a rotator cuff repair, your surgeon may limit that for 4 to 6 weeks, it could be 2 or 3 months. So that's important to know on the front end. At the end of the day, this is something you're really going to have to ask your doctor, because there's so many variables. Those two main categories, the nature of the surgery itself, and then what exactly you do. But it may vary a little bit based on some little things that your surgeon recommends for you. Another thing I want you to think about, though, is even if you can get to work, and even if it's a desk job and you can write and you can type, and if you're in a sling after surgery, you can't drive. So somebody's got to figure out, or you're going to have to figure out how to get, have somebody help you get to work and get home. Yes, I know people drive with one hand all the time. I get it. But the problem is that people that the other arm is healthy, they can reach up and grab the wheel really quickly. So if they need to swerve the car, they can do it. If you've only got one arm because your other arm is immobilized in a sling, you can't do that. So it is not safe to drive. Another good question to ask your surgeon. But those are the general concepts when you're trying to decide, when would I be able to get back to work after a rotator cuff surgery. Have you had a rotator cuff repair? And how quickly did you get back to work? What did you do about driving? Did you have to modify your activities? I would love to hear your thoughts. So below this video, share your experience. I would love to read it, and I know people around the world would love to hear what you have to say as well. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page. You'll get videos, I record a couple of these videos every week, and they'll get delivered directly to you. Thank you so much for watching. I really hope that this was helpful. If you're trying to deal with a shoulder surgery, specifically a rotator cuff surgery, and trying to figure out when you might get back to work, hopefully now you know good questions to ask your surgeon. Thank you so much for watching, and I look forward to seeing you right here next time.